Hello and welcome to today's topic, Apex Locators. Apex locators are used to determine the working length in a root canal without the use of any radiographic techniques. It is commercially available as endometer, sono explorer, and as neosign. The working length is determined by comparing the electrical impedance of the periodontal membrane along with the oral mucosa, both of which should be similar to 6.5 kilo ohm. Generations of apex locators. First generation or the resistance apex locator measures opposition to the flow of the direct current or the resistance. It works best in dry canals. Second generation or the impedance apex locator. It measures the opposition to the flow of the alternating current or the impedance. It is calibrated with the periodontal sulcus prior to each use. Third generation or the multiple frequency apex locator determines the canal terminus as the difference between the two impedance values at two different frequencies of 1 and 5 kHz. Fourth generation or multiple frequency ratio based apex locator. It uses two wavelengths whose impedance should be compared as a ratio. The recent advancement: integration of the Appex Locator with the battery-powered endodontic slow-speed handpiece. The file starts to rotate automatically the moment the instrument is introduced into the canal. If the preset torque level for the instrument is exceeded, then the file rotation automatically stops and reverses rotation of the file tip, beyond which it may extend the working length. Electronic apex locators. It is the most optimal and accurate method to establish the root canal working length. It is used to determine the working length for the canal preparation in conjugation with radiographs. It uses direct or alternating current to locate the apical constriction. Parts of an apex locator includes a lip clip, file clip, an electronic device, usually a LCD display, a cord connecting the three parts. Procedure. One end of the cord is termed as lip hook that is kept in contact with the oral mucosa of the patient. Other end is termed as file holder, which is a probe attached to an endodontic instrument, usually a K file or a rotatory file. The attached file is slowly inserted into the root canal up to the estimated working length. When the endodontic file touches the soft tissues of the periodontal membrane, the electrical resistance gauges for both oral mucosa and periodontal ligament, which would have similar readings. By measuring the depth of insertion of the endodontic file, one may determine the exact working length of the root canal. It is indicated when apical portion is obstructed by impacted teeth, tori, malar process, zygomatic arch, excessive bone density, overlapping roots, and shallow palatal cavity. Also indicated in pregnant patients, disabled or highly sedated patients, patients with gag reflex, also in children. It is contraindicated in teeth with immature open apices, calcified or blocked canals, excessive hemorrhage or inflammatory exudate in canals. Measurements get altered when the file contacts any metallic restoration or when measurement is taken through a tooth having a metallic crown prosthesis, also in patients with cardiac pacemakers. Thank you.